want to keep to that. So I'll do a quick introduction and we can get underway, and I'll just keep on admitting people as we go on. I would ask everybody in the room to make sure that you're muted while the presenters are presenting, and then we'll open up the floor to questions, and you can unmute and ask your questions, or raise your hand, or type in the chat. So good afternoon, everyone. I'm Sherry Somerville. I am the CEO of the Atlantic Chamber of Commerce, and welcome. Thank you for joining us today. A very big topic, you know, in light of COVID, of course, but also prior to COVID, was the impact of immigration, population growth, and also now with COVID, the return to work. And we have joining us today, Mel Norton. He's a partner with Lawson Creamer, and Janet Thompson Price, who is with the Atlantic Fusion Law Group, and are going to talk to us today about those two issues. And I'll briefly introduce Mel and Janet, and then I'm going to let them take the reins and provide their knowledge and wisdom to us. Mel joined Lawson Creamer in 2000 upon his admission to the New Brunswick Bar. His practice focuses largely on labor and employment, debtor and creditor law, and construction litigation. In 2010, Mel was welcomed into the partnership team. He is actively involved in the Canadian Bar Association and is the former chair of the Young Lawyers CBA-NB, a former member of the executive of the Labor and Employment Group, and a former peer volunteer for the CBA New Brunswick Lawyers Assistant Program. Mel volunteers his time to his profession by teaching seminars and courses in his areas of practice, including the Bar Administration course of the Law Society of New Brunswick. Janet is an immigration lawyer who is passionate about helping newcomers. She is the co-founder of the Atlantic Fusion Law Group, an immigration and business law firm with offices in St. John and Charlottetown. She has also taught immigration law at the Faculty of Law, University of New Brunswick. Janet has proudly helped many people immigrate to the Maritimes, assisted employers with their immigration strategies, and volunteers her spare time to help welcome newcomers as they arrive. And she created a Facebook group for newcomer women to help them make social connections after they arrive, and promotes businesses owned by newcomers in the community. She is also the proud mom of 3 kids. So welcome to both of you. Thank you for spending your noon hour with us and with some of our members. It's a very timely topic, and I will let Mel, I believe you are starting us off.
Thanks very much, Sherry, and thank you to everyone who is taking some time at lunchtime to join us for this presentation. This is particularly fun for Janet and I. We've had the good fortune to know each other for many years, and to work together from time to time. So thank you to you, Sherry, and your staff members and colleagues across Atlantic Canada for arranging today's session. It's really appreciated, and hopefully it'll be a benefit to your members. I'll keep my presentation to about 20 minutes, and then Janet is going to. I'm going to try to reserve more time for Janet because her topic is really a larger in scope. And then we, depending on how our time is running, we should have some time for questions and answers towards the end of the hour. The topic that I've been asked to cover and go through is something that many employers are dealing with day to day, and it's ongoing. But it really, and I should say also, it evolves almost daily. There are almost new daily and certainly weekly developments on returning to work in each of our respective provinces. And what we were hoping to do is to cover some of the most pressing topics that certainly we see from our clients, and some of the day-to-day problems that they have, which include the COVID-19 workplace policies and procedures. Something that we're seeing more of, which is challenging for employers, is dealing with reluctant workers, and driven by all kinds of factors, and we'll talk maybe a bit about some of those factors. how to deal with suspected or confirmed cases of COVID-19 in your workplace. And then the one that is, and I understand from Patty, who's on the presentation, we now have an Atlantic bubble coming up in early July, and so interprovincial travel will hopefully become a little bit more easy for people. Certainly for those trying to come to New Brunswick, it's been a real challenge, and a few people have even gotten turned around at the border. So that's been challenging for people. So in terms of some of the policies and the kind of the framework for policies in your own workplaces, there are, as you can imagine, few one-size-fits-all solutions, because every workplace is so different. And I know that, I've received questions from clients that say, look, here's my workplace. What's the standard approach for this workplace? And there is almost no standard approach, because every workplace has its own dimensions and setup and numbers of people. So it really is a customized approach to the workplaces. Putting it in writing is certainly a best practice, whatever your policy and approach for returning to the workplace. In some provinces, that's a requirement. That's certainly the requirement in New Brunswick. And having that in place, from our perspective, would help if an employer were ever called on, well, did you put in place the right safety protocols and approach? Having that document there in writing is a nice piece to point to if you're ever questioned as a result of somebody becoming sick in the workplace. And then last but not least, being flexible with that plan. I know certainly in our office, and we employ about 20 people in total in our office. We've had to rework the plan, I think, about 3 times now in the last month or so, just because there's always new developments and you're always trying to tweak and improve things. So that's sort of the context and guidelines. There are a couple major categories of safety processes you can put in place. One goes without saying, almost, it's the passive screening and making sure that on a daily basis, your employees and coworkers are self-monitoring for any of those flu or cold symptoms. And as the Premier of Nova Scotia has now so famously said, if you're not feeling well, stay the blazes home, or words to that effect. So making that part of the culture, probably like many of you, I grew up in sort of a culture of, if you're at all able to move out of your bed, no matter how sick you are, make sure you get to the workplace, and unless you're literally dying on the floor, stay at your desk. And that culture, really, we have to shift completely a 180 away from that. If you're feeling at all unwell, stay home. And now we've kind of all developed these wonderful remote technologies and become very proficient at them. So you can continue to work if you're able to, but certainly stay away from the workplace. And then the other piece to that passive screening is self-monitoring for exposure to others who may have come from away, as we say in Atlantic Canada. If people are visiting from another province, or the odd occasion when somebody may enter Canada from another country, exposure to them may result in a possible exposure to the virus, and so monitoring for that as well. Certain workplaces are putting in place active screening measures, and that includes things as simple as having someone at your reception or entry point for employees asking the screening questions. Do you have a fever? Do you have any new aches or pains? Do you have are you experiencing any flu-like symptoms? Somebody verbally posing those questions and getting verbal responses. And it could include up to things like temperature checks. And some of the larger workplaces in New Brunswick, certainly, and I know in other provinces, are putting in place temperature check systems that are sort of infrared scanners, but that does get into a whole other level of how do you actually carry out those scans, and that can become tricky depending on the size of your workforce and the training that you have in your workforce to conduct those steps. But making it a requirement that people stay home if they have any symptoms is really the sort of the gold standard at this point in time, when we're trying to keep people safe. certainly in the workplace, if at all possible, physical distancing has been demonstrated to be the most important way to prevent the spread of COVID-19. And so if you can allow folks to work remotely, then that's certainly an excellent option. But not every workplace can accommodate that. I know in our office, we have people that have to come and go. We have clients that we need to meet with. And so maintaining that 6 foot 2 meter separation, having even marks on the floors, marking one-way corridors and actually having marks put down on the floor, taking out, sort of reception area seating, or having less seating in conference rooms, and controlling the flow of traffic in and out of your place of employment are all things you can do to help with that physical distancing. And then along with that, just the hygiene and re-emphasizing using the hand washing and sanitizing stations when people arrive at the place of employment. And then certainly if they're using the washrooms or anything like that, that just really emphasizing good hygiene is an excellent way to prevent COVID-19 from spreading, according to all the experts. There are additional protocols that you can put in place, and some employers are going to the extent of purchasing filtration systems. There are sort of medical grade filtration systems that you can buy for commercial premises that are used sometimes in dental offices and in our hospitals, that can be purchased if you have a really high traffic area or a place where people are particularly perhaps susceptible, then that might be an option. They're very costly, but that could be an option. Certainly enhanced cleaning protocols and a schedule, maintaining a schedule of cleaning, especially the high touch surfaces, doorway, door handles, light switches, commonly used items. And then re-emphasizing some of that etiquette that sometimes we forget about around coughing or sneezing, and then depending again on the amount of time you're going to be exposed to one another in close contact or with clients or customers, especially where physical distancing can't be maintained, considering the use of PPE and making sure that folks have the training to use that, how to put it on, how to take it off, and that you probably will find becomes almost mandatory in situations where you can't maintain that 6 foot 2 meter distance. So having plastic guards in place, requiring masks to be worn where folks are going to be in close contact, and then making sure that material, of course, is available for employees. And then especially if you have people coming and going, making sure that there's some sort of log or record of who is coming into the premises. And that's often part of safety and security protocols already. But if it's not, then it's something that can be added and should be added as part of protecting against COVID. The issue that is probably hottest on our radar right now is how do you deal with folks that do not want to return to the workplace? And certainly the Canada Emergency Response Benefit is playing a role in that, because some employees are making as much or more using the CERB or receiving the CERB than they were at work. In addition, things like childcare and having high-risk family members, folks that may have an underlying condition that makes them susceptible, is creating more challenges for folks. And then there is this concern for personal well-being. In certainly all of the provinces, making sure that you have in place at least the objective safety protocols makes it much more difficult for employees to objectively stay away from work, and puts you as the employer in a spot where, depending on your risk tolerance, you can at least deal with that employee. And so the kinds of things that you can do to make sure that you have the objective protections in place are some of the things we've already talked about: having the written policies and procedures, making written requests to an employee to return to work, so making sure that that's documented. If you do receive kind of a refusal or reluctance to come to work, asking sincerely, why is the person not coming back to work? And from time to time, you'll discover that folks will they'll raise issues that may even touch on human rights related issues. So childcare, so it could raise a family status type of issue, or care for the elderly. Again, it could be a family status issue, and then being open to even suggesting certain solutions. I recall a situation we've just been dealing with recently where the individual said, look, I can't come back to work because I can't find childcare. Our daycare is no longer open. And so what we suggested to the employer is, well, why don't you suggest to that employee to look for a student to hire? There's all kinds of students that are now finishing up university. There must be a qualified babysitter or childcare worker that needs some work, putting that out there and offering the employee some solutions. And then the last point, depending again on your risk tolerance, and this will vary for each employer, you may get to that point where you have to decide, for the sake of the business and operations, that the person has to be terminated. But doing that and looking carefully at whether that's on a cause or not for cause basis, or kind of that hybrid approach of saying, well, it's going to be for cause, but on a purely gratuitous basis, we're going to offer you a severance, a smaller severance, provided you sign a release. But recognizing where those conversations with employees can go once you start pushing them to come back to work and they're reluctant to do so. There is certainly a level of complexity to dealing with both suspected and confirmed cases of COVID-19, and with cooperative employees, anyone who is experiencing symptoms should obviously be encouraged to seek medical care, either from their physician, or in New Brunswick, there's an 811 number, probably similar in the other provinces, and certainly to stay away from the workplace if they have those symptoms. And I think the same can be reasonably applied to those employees if they have family members or close friends. We saw a case recently where an employee said, look, my boyfriend's getting tested for COVID-19 and I've been living with my boyfriend, and so, okay, you stay home until your boyfriend's test comes back, and that employee was very, very cooperative. There are cases where folks will refuse to get those tests, and so it gets into that area of, can you compel an employee to take that test? Well, as an employer, you have this obligation to protect the health and safety of employees in the workplace. And so you may have to get to the point of, putting in writing, you must go and get that examination, get that COVID test, get medical attention, or we're going to have to suspend you at least for the 14-day period, or maybe consider terminating their employment if they're not following that kind of reasonable direction. And then certainly if there are confirmed cases, having conversation with the public health or that equivalent in your provinces to give specific guidance on how do you deal with other employees while maintaining confidentiality, but still protecting the health of the community in general. Just flip to the next slide. There are obviously real challenges when it gets to privacy and the intersection between somebody's health information and making that public. I certainly wouldn't suggest you go and advertise that somebody's being tested for or has a confirmed case of COVID-19. If you do find out that somebody in your workplace is tested positive, then contacting public health or public safety, that equivalent in your province, is probably the best step that you can take to putting in place a process to, if necessary, discreetly notify people and taking their advice on how to protect your workplace and the public at large. In terms of interprovincial travel, there has been obviously in New Brunswick, probably most famously infamously, I guess, in the Campbellton area, this issue around potential liability as a result of travel to Quebec and returning without following or apparently not following the obligations to self-isolate. Certain workers' compensation impacts could be at play and could put an employer at risk, so that if a person were to travel and and end up spreading COVID in a workplace, that could cause increases in premiums or assessments from a workers' compensation perspective. And pending the Atlantic bubble, which is we understand only a few days away, especially if you're coming to New Brunswick. Yeah, Janet, absolutely. I think we're all kind of excited about that. If you're coming to New Brunswick or PEI or Newfoundland, Nova Scotia is kind of the exception. There's no travel ban currently to Nova Scotia, which is interesting. It's similar to Ontario. There's no travel ban. But if you're coming to the other provinces, having stuff with you to explain the purpose of your travel. So certainly if you're a resident of that province, having your driver's license or proof that you're renting or living in that province. We've gone to the extent of printing off people's property deeds or their title to their property so that they can show the border officers that they're actually residents of that province, and confirming and being able to confirm that you understand the obligation rather to isolate and minimally interact with others in that province, and that you also have a plan in place for the logistics. Folks who've been traveling have ended up eating room service for multiple days on end from their hotel without the ability really to do much more than go to and from the work site back to their hotel. So being able to communicate that. Each province is different. Right now, you can assume sort of a 14-day isolation period. And certainly if you're coming to New Brunswick, being ready for that risk that you may be turned away right at the border. The last slide in this is sort of a summary of where we're at right now. Every province in Atlantic Canada is a little bit different. Newfoundland is among the most interesting with very sector-specific travel-related exceptions. New Brunswick and PEI are very restrictive, so being really clear on what it is that you're going to need to show before you travel to those provinces, it will hopefully save you a little bit of pain and get you to your destination safe and sound. I'm going to end my presentation, or my part of the presentation, there, and turn it over to my friend and colleague, Janet Thompson-Price, and happy to take questions towards the end. Thanks very much, everyone.
Great. So, okay. Sherry, I'm just looking here. Oh, here we go. Sorry, I'm just going to share my screen again. There we go.
There you go.
Okay, so thank you very much, everybody. And thank you, Shelley, for organizing this. Mel and I went to law school, so I always enjoy collaborating with Mel. It's always a pleasure. I'm going to hit on the high notes from an immigration perspective and how COVID has really thrown a wrench in immigration. It really is the Wild West. It seems we're constantly getting updates, ministerial orders, travel bans, and then trying to adapt very quickly for employers who are impacted and trying to bring foreign workers here. So how is it impacting immigration? So for the most part, there is significant impact. The Canadian visa offices overseas, and if you're not familiar, often our visa offices use something called a VAC, or a visa application center, to process some of the applications, or at least collect some of the information and documents from people overseas. Most of them are closed, but very recently we're starting to see a few reopen depending on the risk and the amount of COVID in a particular country. So for example, in the UAE, the visa office and the VAC has since reopened. And they're hoping by the end of this month, there might be some additional ones reopening. I keep checking every day, so there's always a few, so that's progress. But obviously the closures have had a major impact because the VACs, if they're not open, they're not accepting paper applications. And the big one, if you're having temporary foreign workers come in, they can't take biometrics. So during the processing of any work permit application, people actually have to go to these VACs and they give their biometrics, which would be like digital photos and digital fingerprints. So without that, work permits can't be processed with very limited exception. And then on the back end, if people are applying for permanent residence, with VACs being closed, they can't give their passports to put a visa in. Inside Canada, they are still processing applications at case processing centers, but they're working at substantially reduced capacity with a focus on high priority applications. So for example, trying to bring in essential workers, possibly physicians, or in the food supply chain, those are getting the highest priority of processing. Operations are not expected to return to normal anytime soon. With the CBA, we're in constant contact with the high levels of immigration, with Immigration, Refugees, and Citizenship Canada. And so they're saying, like, there's no expected return to normal anytime soon. And then of course there's travel bans coming to Canada and also provincially that Mel had touched on. And then the other thing I think is quite relevant for employers are LMIAs. So Service Canada or ESDC, they're still processing LMIAs, which are needed for a lot of work permits, but they are delayed significantly. And just as recent as this week, again, through the CBA, we're hearing to expect changes. So say, for example, you're an employer and you've submitted an LMIA application at the beginning of March and you haven't heard anything. What we're hearing is because of the high levels of unemployment locally due to COVID, that ESDC is very likely going to require new advertising before they will finalize an LMIA application. So if you're an employer with a submitted LMIA, you might get an email sometime soon saying, we'd like you to re-advertise for another 2 weeks or so. So who can actually come to Canada right now? So temporary foreign workers who already had a work permit application approved before March 18th can travel to Canada. And of course, the big caveat is if they can get on a plane, because a lot of international flights have been canceled or continue to be canceled. But if by some reason they can get on a plane and come here, if their application was approved before March 18th, they can still come. Fortunately, last week, there were some updates that immediate family members of Canadian citizens and permanent residents can come, but there still are some restrictions there. So immediate family members would be like a spouse, a dependent child, a parent or parent of a Canadian citizen or permanent resident, or maybe a guardian. They have to show that they're coming for at least 15 days, and then it can be for a discretionary purpose. But if their trip is going to be 15 days or less, then it has to be non-discretionary. The other thing is they obviously have to show that they don't have any COVID symptoms or they have no reason to believe that they have COVID. For temporary foreign workers or study permit holders, the only way they can have immediate family members come is if they have prior written approval from IRCC. Also, IRCC is still processing work permit applications, but unfortunately, unless the person was somehow able to give their biometrics or can give biometrics if a VAC is actually opened, those permit applications are going to be put on hold until such time that biometrics have been reopened. And in Canada, as far as I know, there's no estimated date on when Service Canada is going to start processing biometrics again. So if you have workers that are coming to Canada, I thought it'd be helpful just to have a screen to say, you know, what can you expect? So obviously when they arrive at the airport in their home country, they're going to be screened for COVID symptoms. They have to wear masks on their flights. And when they arrive in Canada, they're also going to be screened again by CBSA officers to make sure that they don't have any COVID symptoms. And then the other thing is they have to show that they have a written quarantine plan, which is going to show like where are they going in Canada, what's their final destination, their employer contact information, and how are they going to get to their quarantine location. And they have to take private transportation. If they have this that's satisfactory, then they will be allowed to board a connecting flight to come to the Maritimes. Another thing is they have to show how are they going to have food, because obviously when they arrive at their quarantine location, they can't go to the grocery store within that 14-day period. If CBSA is not satisfied with the quarantine plan, the workers can actually be required to go to a designated federal facility, which is not optimal by any stretch. So you want to make sure your workers have this plan in place. There are certain workers that are exempt from quarantine requirements, but that's the exception to the general rule. So under those kind of exceptions, it would be if they're coming with some kind of urgent medical supplies or in the trade and transportation sector. So the employer's responsibilities during COVID. this is really important. So when the worker is coming in for their 14 days quarantine before they're allowed to work, the employer has to still pay them. And it's based on a 30-hour work week. And they have to be paid the rate of pay that was specified in the LMIA, or if the work permit was LMIA exempt, what was specified in the offer of employment. So during that time, workers, they're not eligible, but they should not be applying for the CERB benefit because the employer is required to pay them. The other important thing to note is the employer can't prevent or inhibit workers from meeting this 14-day quarantine under the Quarantine Act. So again, if the employees are coming in and there's no way for them to access food, if they don't know people here, the employer should facilitate how the food is going to be coming to them. Maybe the employer is going to have it delivered. The employer does not have to pay for the food, but they do have to facilitate how the food is going to get to them. For employers who are required to provide housing to workers, so for example, if you're in like a low wage position or like in seafood processing plants, possibly like if they're actually going to be in some kind of worker accommodations, you have to make sure that they have that 2-meter separation during the quarantine period. So if they're going into a facility where that 2 meters can't be provided, you probably are going to be required to come up with an alternate quarantine location, such as a hotel room, to make sure that when people come in for that 14 days, they're not going to be near anyone to potentially expose other people to it. And then this is interesting. So say you have some kind of accommodation facility where you're housing multiple workers. And say you have several workers that come in first and they're maybe on day 7 of their 14-day plan. Then all of a sudden you have another wave of workers coming in. If they're coming into that same facility, it's like the 14-day clock starts over for everybody, because potentially the people that were already there could be exposed. So that everyone again has to go to this 14-day self-isolation. And so Mel's already touched on this. If a worker becomes sick, similarly if a temporary foreign worker becomes sick, the employer in this case has to immediately arrange for the worker to be fully isolated. The employer should contact the local public health authority. If the worker becomes ill during the initial quarantine, the 14 days, then the worker must be paid by the employer. If it happens afterwards, you're most likely going to be looking at the employment contract to determine how are they going to be paid through like sick leave or what have you. And then again, after this 14 days, they might be eligible for EI or the CERB benefit. And so what I would stress here, compliance and inspections, you don't want to mess around with the Quarantine Act. You want to make sure as an employer you're following it to a T, because if a temporary foreign worker is found to be in non-compliance, the penalties under the Quarantine Act, fines can be as high as $750,000. If a person is reckless or willfully contravenes the Quarantine Act and actually causes a risk of imminent death or serious harm, the penalties could be $1 million or imprisonment of up to 3 years. And also workers can be found inadmissible to Canada under IRPA, the Immigration and Refugees Protection Act. They can be issued a removal order and then barred from coming to Canada for 1 year. And they've actually, the government's amended the IRPA, which came into force on April 20th, which compels the employers to meet these requirements that I've touched on, such as paying for the initial quarantine period, paying their salary, not preventing a worker from meeting their obligations under the Act. And then again, employers can be subject to fines of up to $1 million. And so how are inspections being conducted? So if you're an employer and you're familiar with the LMIA, or even with an offer of employment, you're subject to potential inspections or investigations to make sure you're complying with what you said in the offer of employment or the LMIA application. And so right now, obviously because of COVID, the inspections are being done virtually. An investigator will contact you by phone and may request some documents, and they must be provided within 48 hours. You might have to actually have a virtual tour and go through the accommodations or the work environment to make sure that the employees are safe. And there might be interviews, which will be conducted by phone or video conference. So permanent resident applications, and I'm not sure how relevant that might be to employers, but it might be if you're an HR professional and you might have been helping, or if an employee comes to you and just asks you some questions. So IRCC is still processing permanent resident applications through Express Entry, through provincial nominee programs, and the Atlantic Immigration Pilot Program. They're still conducting draws both federally and in the provinces, which is great. So things are still going ahead, but obviously not at the same speed, and the standard processing times don't apply. And obviously there are challenges with a permanent resident applications. So again, biometrics are required for permanent resident applications now, but with Service Canada being closed, people in Canada can't give their biometrics. Or language tests, which are required for all permanent resident applications. There's no language test being conducted right now. And so IRCC has acknowledged that, and they're giving a 90-day extension to submit supporting documents that can't be obtained because of COVID. And then people are advised that they should provide an explanation on why they're not providing something, as opposed to just not providing it. And then if you've ever helped with a permanent resident application, once you submit an application, typically in about 2 months' time, the government sends an acknowledgement of receipt email, or AOR, that assigns a file number to your application. These are taking much longer. I know I haven't received any since the end of March, and particularly the Case Processing Center in Mississauga. I mean, Toronto's been hit hard by COVID, and their office has been hit hard. So things are taking a lot longer to come out of the CPC Mississauga office. Applications that are in the final stages are often being held. And this is because when someone is finally approved for permanent residence, they get this confirmation of permanent resident document and a landing visa, and the people have to come within that specific period of time. And so they don't want that document to expire. So they're actually kind of holding that final stage approval until such time that the offices are open, and then they can issue these COPR documents. And then for people that had been approved, like say February, March, what they're doing now, because you can't go to the border to land as a permanent resident, they're actually doing virtual landings. And often people are just getting an email out of the blue saying, congratulations, you're now a permanent resident. You can use this email as the authoritative legal document that you're a permanent resident. And we'll send you something more official when we can, basically. So looking forward, in the short term, so visa application centers and visa offices are very slowly starting to reopen, which is a good sign. Citizenship applications are actually proceeding by Zoom, if you can imagine, citizenship by Zoom. So people can become citizens and not have to wait for these large group ceremonies. And like I mentioned a minute ago, permanent residents can be landed virtually. The good news is long term, both the federal government and the provincial governments are all on the same page that immigration is going to be essential for economic recovery post-COVID. And so immigration, if anything, is actually going to increase and not decrease. Our federal immigration minister last week alluded to actually increasing the immigration levels in 2022. So every year we have targets and how many people can immigrate under certain sectors or pieces of the pie to Canada. And this year we're probably not going to meet the level that had been assigned for 2020. So going forward, I think it's going to increase, and he's alluded that it probably will increase, which is a good thing. And then in New Brunswick, at least, our premier, he's reconfirmed that immigration is going to be very important, and immigration is fully supported by the province, and likewise in the other Atlantic provinces. Obviously, we still have the same issues that were there before COVID. So we have aging population, we have lower birth rates. We need skilled workers to come to the Maritimes to replace the retiring workers and also help grow our economy. So immigration is here to stay and hopefully continue to grow. And also, and we haven't seen any specifics, but last week in the news, again, our minister has confirmed that they're going to be using this time where offices are closed to look at how can we overhaul the overall system for immigration and make it more efficient. So things that they're doing on an urgent basis, such as virtual landings, might become a wave of the future. And how else, like maybe more online applications. So certain applications are paper-based. I think now they're going to try to get everything online because it's much easier and quicker to process. And so that's it. I tried to go through it so we had enough time for questions, but that's my presentation.
I have to say, you both are right on the money in terms of time frame. That's awesome.
Great.
Yeah, I'm going to open it up, folks on the call. If you want to, you can raise your hand, take your mic off, ask a question, or you can put it in the chat function. We're watching that, and as we give people time, I'm going to start off just one to hit the ball running, and it goes back to what you were just talking about with the Atlantic Immigration pilot and the provincial nominee program, Janet. You know, those challenges before COVID were great in terms of our population decline, aging, graying population declining. And we do need population, we do need skills. And I know some people think of, unskilled labor that's coming in, but we need skilled labor too. Is there any talk of expanding those two programs in any way, shape, or form to increase the numbers or, our targets?
That's a really good question. So I think if you ask any provincial government in the Maritimes, they're always asking for it to be expanded because they know the need here. The federal government sets how many allocations each province can have. So it's not up to the province just to say, okay, we want X number of people. They have to negotiate and they have contracts with the federal government.
Okay.
On the good side though, even though it's called the Atlantic Immigration Pilot, it started as a pilot, but it's now become permanent.
Yeah, my colleagues across Canada quite often are a little envious of the pilot that we do have. They would like it in other provinces for sure.
Absolutely. And then I know skilled workers are obviously, a huge thing that everyone's advocating, but we also need lower skilled and like intermediate skilled workers. And the pilot, to my knowledge, is one of maybe the only, if not one of the few programs where you can bring in intermediate skilled workers. So like the NOC skill level.
I'm just taking a look. From the group, does anybody? Oh, there's Brandon. I do have one for Mel, but I'll let Brandon, you go right ahead, sir.
I was just going to build on that question you just asked, Sherry. Janet, what would you say is the biggest improvement that could be made to the AIPP right now? If you had a wish list, and what would essentially be at the top of your list for improvements to the AIPP?
What I hear from employers is sometimes like the frustration, or even employees, like if they're handling applications on their own, the hardest part is getting past the mailroom, believe it or not, in Sydney, Nova Scotia with the federal government. So when you submit an application, everywhere online says you don't need a lawyer to help you with your application, you can do it on your own. And then people do that, they send the application, it might sit in a mailroom for 2 months, and I'm talking about before COVID. And then literally if a document is missing, or maybe a form wasn't the most current version of the form, or a signature is missing, it gets sent back as being incomplete and they have to start all over again. So I think from a wish list, from what I'm hearing from people, it would be, why can't there just be a little bit more back and forth, like an email saying you have 30 days to provide this missing item.
So just a little more assistance from the bureaucrats is what you're...
Yeah, both federally and provincially. Like every province is different. Some provinces do a lot better and there's a lot more assistance and communications with the employers. Some not so much, but I don't want to say which.
No pointing fingers. Mel, question for you. There's an interesting topic that we're talking about, and again, across Canada. Ontario is a big one for it, but contact tracing. And the government, the federal government is looking at an app. What are you hearing in terms of, because I know people have privacy concerns around the whole contact tracing and whatnot. So for people, for employers, what are you hearing?
Yeah, it touches right on that intersection of the obligation to maintain a healthy and safe work environment for your staff and the privacy obligations that employers have as well. And in kind of pre-COVID times, not that long ago, you wouldn't probably think of maintaining logs of things like temperatures and health status of folks. In this new world that we're living in, I think employers have to probably revisit what they were doing in the past. And the contact tracing, probably, the tip of that iceberg are things like those active screening measures. So if you are an employer that puts in place an infrared temperature scanner at your door, or have a temperature gun, then what are you doing with the data that you're collecting? Is it going into an electronic log? Are you maintaining that log? How long does that log get maintained? Does everybody's temperature get maintained, or just the ones that are over the prescribed temperature? Because that really is that begins that process. And then with the contact tracing, where do you draw the line of starting to inform coworkers or visitors to the premises that there's a COVID case? And I think what we've seen, and Janet mentioned this, really contacting the provincial authorities at that point where you have a confirmed COVID case and where tracing needs to take place, really asking public health or public safety, that equivalent in your province, to be the standard bearer for who's going to be told what. As the employer, though, probably there's an obligation to at least have the data available kept in a confidential way for some, I suppose, for 14 days after it's been collected, and putting in place that kind of a system. But it's right at the intersection of privacy and health concerns, and certainly a touchy spot for understandably for many.
Well, it's interesting because I was watching one of the newscasts recently, and they talk about it's a complex algorithm or algorithms of numbers and whatnot that you never actually get people's information. At least that was my limited understanding of it. So in that respect, if something came out and there is no way of actual tracking it back to individual people per se, would employers actually be able to require an employee to participate in contact tracing?
I think so, Sherry. I think that at this point, and I heard one judge, or I read one judge's comment in a case, kind of, I think, borrowing from the Prime Minister, and he said, because it's 2020, we're going to do it this way. And the reality is we're living through an unprecedented, at least certainly in all of our lifetime, and the most significant healthcare issue in 100 years, this global pandemic. And so in pre-COVID times, would you have been offside making those requirements? Probably so. Now that it's so risky and there is such a concern, would you be onside? I think you could. I think you could put in place a workplace policy that requires that. The best practice with any workplace policy, of course, is to provide advance notification of that policy going into place. But could you speed up that time horizon now? I think you could. I think you could say to employees, much like we've done with other COVID policies, last week our policy was, this week our policy is. And because you really have to be nimble and move with what's required. And so as testing is continuing to ramp up, and contact tracing along with it, I can certainly see that as very justifiable.
Well, and if they do get the privacy aspect, again, if it's a complex algorithm of numbers that are assigned to individuals and there's no way of pointing a finger to, oh, Mel, it's you, or Sherry, it's you, that might be the most privacy protective way to go about it. And, we've had conversations too. Everybody anticipates the second wave coming in the fall. And then just this morning we were talking about, well, do you ask businesses to close down again? Not sure if our economy can handle that. And contact tracing might just be that way of, where if we've got temporary foreign workers coming in, if we've got our employees and we want them to come back to work safely, might be the way to go. I'm not sure.
Yeah, that's right. I mean, if you get testing to a certain level, now, mind you, it's a very high level, you can essentially keep the economy open full bore. I can speak from, some of the information we've heard from our own province and the Department of Public Safety, that they're predicting and planning for a second wave in about 3 to 4 months' time. And that's based really on what's happening in China right now and what they expect will happen in New Brunswick and probably the rest of Atlantic Canada. So governments are likely putting in place those plans for possible second lockdowns if we don't have sufficient testing and tracing.
For sure.
I was just gonna, a nice little kind of aside, speaking of contact tracing. So I was speaking with a colleague in Taiwan several days ago. And obviously that country's been enormously successful with their testing. Like their economy, it's doing quite well. Schools are open, restaurants, everything is open. And their cases are very, very low. And so it was sweet. This colleague has actually sent me an entire box of masks because they just lifted their medical restrictions that you can actually share them with people now. And so she was concerned about New Brunswick. And I'm going to today delivered that and Taiwanese pineapple cake, which is my favorite.
Oh, there you go.
Yeah.
Would anybody else, are there any other questions from our participants? Don't want to hog the mic. I actually had questions for once. Not seeing anything. Well, okay, so folks, and this is recording and we're going to be sharing this. Mel, Janet, if people are looking for information, you know, again, this situation is fluid, things are changing every day. If an employer is dealing with some return to work concerns and issues, trying to navigate through them, or if an employer is trying to work through onboarding temporary foreign workers or permanent residents, where can they go for help? Where are the key areas that they can turn to, apart from, of course, calling you both?
Certainly on a COVID-related note, looking to the equivalent of WorkSafe New Brunswick or WorkSafe PEI or Workplace Newfoundland or WCB Nova Scotia, all of those organizations have excellent resources on their websites for helping employers with many of the issues that we've touched on today.
And so on an immigration perspective, IRCC's website, right on their main page, so www.gc.ca, they have like COVID impact, and you can actually click on the link and how it would impact you, whether it's a temporary visa application or a permanent resident application. But because change is happening so quickly, probably the best thing is to follow IRCC on Twitter, or the Federal Immigration Officer on Twitter, or CBSA on Twitter. We have a firm Facebook page, and I try to share any change that I see right to the page. So you could always like our page, and then that might give you some up-to-date information as well, hopefully.
Fabulous. Well, both of you, thank you so much. Very, very interesting. I took 2 pages worth of notes. So anyways, we'll record this. Like I said, it's recorded, and we'll be putting this, sharing this with our chambers so that they can share with their members as well. And I want to thank you both very much for spending your time here today, and for the participants for participating. And I hope you all have a great weekend. We're coming into it, so the weather looks really, really nice to kick off Canada. There's Heather's kicking off Canada Day with some sunshine.
Okay.
Thank you, Sherry. Yes,
Excellent.
enjoy the bubble. Thanks.
Thank
Thanks,
you.
folks.
Thanks, everyone.
Thank you.